Welcome to This Week in South Carolina. I'm Gavin Jackson. COVID-19 cases continue to rise in South Carolina and across the world, and it's affecting everyone here in our state. Business owners, employees, students, parents, everyone is in this. And right now we're seeing South Carolinians do what they do best and step up to help others. Here's the latest from this week. This week, state officials announced that South Carolina is entering the acceleration phase of the COVID-19 virus after seeing consistent case increases. State health officials project there could be more than 8,000 cases of COVID-19 in the state by May 2nd.
Well, if you could picture in your mind a sort of a bell-shaped curve, we would be on the front end of the steep side of that curve. So we've transitioned to a flatter, slower uprise to a more rapid peak. Now, how rapidly that increase occurs depends on how effective our measures are for community mitigation strategies.
Department of Health and Environmental Control Director Rick Toomey said more critical needs supplies are coming.
We will use a similar methodology, and where in the previous distribution we withheld 10% for emergency issues, we plan on distributing 100% of the materials that we receive in the second shipment. We do not know if there's a third or fourth shipment, but we are pleased to know that we're receiving a second shipment so close because all providers are still running low of supplies.
State Superintendent of Education Molly Spearman and Governor Henry McMaster announced that schools will remain closed through the month of April as the state continues to fight the disease. Major cities in the state continue to take action. Greenville, like Columbia, implemented a curfew this week, and the Charleston City Council approved a stay-at-home measure for the next 2 weeks. While South Carolina continues to adapt to this new normal, some are finding ways to help. Jensen Ronk and Savannah Etheridge of Stitch Down South in Florence switched from sewing boutique-quality dresses for girls to sewing scraps into surgical masks.
We want to do whatever we can, and this is an easy way for us to do it because we're normally sewing every day anyway. So.
Yeah, and for me personally, I have health issues, so doctors and nurses are extremely important to me. So I was like, I'll definitely make masks as long as I can, and hopefully it can make at least a difference for the people that actually get one.
On any given Sunday, the brunch line would be out the door at Cafe Strudel in West Columbia, but last Sunday's brunch was more of a trickle of takeout orders, like it's been for hundreds of restaurants that have scaled back.
When the governor said dine in and take out only, I said, all right, what do we do now? We do some takeout and delivery, not a whole lot. We've got a ton of inventory, and if we can continue on with some sales to generate some cash and hold on to any cash that we got to try to weather it, that's what we're trying to do, and just to keep our customers and people to, knowing that we're fighting it and we're still going to be there. We've been there for them, and we're still going to be there. So I felt it important to keep the doors open if we could.
While some in the food and beverage industry continue to work, others have been laid off, as well as those in the hospitality, retail, and tourism-based industries, driving unemployment claims by 1,600% for the week ending March 21st over the previous week, with 31,000 claims, though some relief from Congress is forthcoming. And I'm joined with Dr. Brandon Trexler, who's a DHEC control physician. Hey there, Dr. Trexler, how are you today?
I'm good, thanks. How are you doing?
Good. Thank you for joining us. I want to ask you just straight off the bat here, just how the situation is in South Carolina. We see these case numbers going up. I want you to maybe tell people what you guys are seeing and how this situation is faring. We're talking about this acceleration phase. Just kind of give us an idea about where we are right now.
Sure. So as of basically through midnight on Wednesday night, so through Tuesday, we have a total of 424 cases in the state. We added a total of 82 cases in the last 24 hours, which is more than we had been experiencing on an average basis before that. So we are in the acceleration phase here in South Carolina, where we're really seeing those case counts increase significantly. As that goes up, you'll notice that our focus in terms of how to control the disease is changing some as well. So we'll be focusing less on individual case investigations and diving extremely deeply into those to more community strategies to slow the spread of the disease.
And when you look at these numbers, like you said, like the large number increase, what's driving this? I mean, what can you guys look towards? Is this happening in clusters and areas where we've already seen that widespread activity, or is it happening in nursing homes, or where do you see this happening and why?
So we're definitely seeing it in some counties more than others, though that is even changing as we're increasing in cases. Obviously, some of the bigger, more urban areas in the upstate and Midlands, and then, of course, in the Low Country, are seeing the highest number of cases in some of their counties. But we are seeing increases. We're in 39 of the 46 counties through Tuesday as of Wednesday morning. So we're adding a couple or a few counties every day. We're seeing it spread out.
And when we look at these numbers, we're kind of on a delay, right? Like this is stuff, these numbers, these incidents happened a couple days before, and then we get the testing. So kind of maybe walk us through how a number becomes reported at this point, where it's, the contact, maybe first contact to testing to being reported and being part of this.
Sure. And it varies a little bit depending on where somebody goes for testing or how they get screened for testing. But essentially, if somebody goes through either their provider or, a telehealth type scenario, which there's several of in our state, and they are recommended for testing because they have symptoms, then most of the time, most people are going through these drive-through testing facilities that are set up throughout the state by some hospital systems. Of course, other people are hospitalized and are in the hospital, and so their specimens are taken there. This is actually not a blood draw. It's a nasal swab, very similar to testing for the flu. And so that goes then to either private labs or to the DHEC Public Health Lab. And there are going to be, I believe, a couple of the bigger medical centers in the state that are going to have their own lab capabilities soon. But the turnaround time right now for those private companies is longer. It's anywhere from 4 to 8 days. For our DHEC Public Health Laboratory, it's about 24 to 48 hours once it gets to Columbia. And so when we receive those results, the providers receive them, and then they notify the patients, essentially right away.
And then your colleague, Dr. Linda Bell, the state epidemiologist, she was talking about basically how sometimes people maybe get a false sense of security when they see these numbers by county. Why is that? I mean, this is widespread at this point and it's ongoing. Tell me maybe why people should look at, overall precautions instead of just, hey, there's only one case in my county.
Right. Well, we know that the number of tests that are being performed and that are coming back positive are very much underrepresenting. They're falsely low in terms of how many people out in the community are actually infected. We don't have a good analogy. I can't tell you for every one person that we test positive, a certain number are actually out there positive. There's various, modeling methods for that. But in general, we have it throughout the state. It is widespread throughout the state, and you shouldn't assume that if there's only small numbers of people who have tested positive, that they're the only ones with the disease. There are probably many other people who had very mild illness and didn't get tested who are walking around.
Mm. And you just mentioned modeling. It's DHEC is coming out with some modeling that they're releasing today as we're talking. Can you guys elaborate about what this is and how this is going to maybe help or give some perspective on what's going on with COVID-19 in South Carolina?
Sure. So some of our statisticians look at the modeling and are able to forecast out maybe how many cases we'll have going forward at certain time periods. And then we can do that social distancing, as we've heard us talk about a lot, to try to decrease those numbers. So basically right now, the projection for how many new cases we would have in the state is predicting over 2,500 by April 2nd and over 8,000 cases by May 2nd. However, like I said, if folks stay away from each other, especially stay home when they're sick, perform that social distancing, really are good about washing their hands and not spreading the disease, hopefully those numbers will in reality be lower.
And when you look at those numbers, that's just cases. And when we look at the caseload we have right now, is there any way to extrapolate, maybe that majority of these cases will be mild based on what we're seeing right now? And when we look at our caseload right now, the 400 or so, are they a majority mild cases? And if so, does that mean that these 2,500, these 8,000 cases could be relatively mild too? How do we look at this?
Right. So we're working on getting specific data for hospitalization percentages and length of hospital stay for those that do have to get hospitalized. But we know from larger data sets from other places in the United States where it's good, reliable data, and we feel are comparable to what will likely be happening in South Carolina, that about 4 out of every 5 people will just have a mild to moderate illness and will not need to be hospitalized. So it's that fifth out of 5 people that we really are concerned about. They're the ones that are more at risk for serious illness.
So Dr. Trexler, when you look at those numbers, those 4 out of 5 people that, have mild, almost flu-like symptoms, but I'm wondering about that 5th person, and when you start extrapolating that, when you look at this modeling, does that worry you about how this might overload hospitals and we might start seeing other places having to take patients on?
I think that anybody that sees what's happening, not only in other places in the world, but even in the United States now, such as up north, definitely has some concern. We are certainly being proactive. We, along with multiple other agencies in the state and with the governor's office, are working to be prepared for basically even the worst case scenario, and then of course hoping for the best. But one thing we want to remind people is, don't go to the emergency room unless you really need to, unless you just can't care for yourself or your family can't care for you at home anymore, because we don't want the ERs flooded with people who just have that mild to moderate illness.
And last week, the governor signed the $45 million law to give more money to DHEC, $45 million to DHEC. How is that helping so far? What are you guys using that money for? And have you seen a change already in the past week since that the governor signed that into effect?
Sure. So a large amount of that money is going to staffing needs. So especially bringing on some new staff or bringing back even staff who has left the agency previously, and especially in some of these disease control areas. And yes, I'm seeing we have a task force for that hiring. And from the moment that money was given to us or appropriated by the legislature and the governor, they've been active in recruiting and going ahead and hiring. And I've even spoken to a couple of folks that are new to the agency when I've called for various reasons, different parts, and they were brought on specifically for this response.
Mm-hmm. And just a few moments left, I want to ask you just about that acceleration phase that we've talked about. It's going to get worse before it gets better, essentially, or is there a way we can still flatten the curve, or is it preordained, essentially, at this point that we're going up? I mean, how do we see this when we hear that acceleration phase?
Sure. So we are definitely still going up, but we still have time to flatten the curve. That we are going up at a very quick rate, but we can still slow that rate. And how high that curve eventually gets absolutely can be modified by people and by what we do. And so that's what we want to do. We want to slow that increase, and we want to not let it get as high at any one point. And so that's what you hear about flattening that curve. And so absolutely, like I was saying earlier, folks can do that social distancing, not gather in groups. The governor signed an order the other day giving law enforcement the ability to break up, I think, groups larger than 3 outside of someone's home, though he asked them to use discretion for that. But really just be around other people if it's essential. Just so that'll really be the biggest factor, along with washing your hands frequently and slowing the spread of this.
And just a last question, Doctor, do we need to get a shelter-in-place order in place, or do you think if people follow these rules, we won't have to go that drastic?
I'm optimistic that we would not have to go that drastic, if people really adhere and listen and follow the recommendations to stay home. Only go out absolutely if you have to. Almost close to a shelter-in-place, but a voluntary one.
Gotcha. Dr. Brandon Trexler with DHEC, thank you very much for joining us on This Week in South Carolina.
Thank you.
As businesses continue to close and people are out of jobs, one area of the economy has seen a slight uptick, and that's the real estate market. And this is due to the Fed cutting interest rates due to market volatility in the stock market. And our ETV Carolinas team has this report on the real estate market in South Carolina.
The biggest effect that the COVID-19 virus has had has been solely on the mass of loan applications that we're doing. People are coming in with refis, people are coming in with purchases, and they are taking advantage of the lower rates for both. So our business has doubled.
A buyer that's been in the market for a while and that has their lending either already in place or had maybe a pre-qualification letter is now looking at the interest rates and going, wow, I don't know when we've ever seen them this low. And especially the millennial buyer, they never have. Matter of fact, we're at the lowest interest rates in 50 years.
There are people out there that are kind of concerned because it is caused by the coronavirus, and they're backing out of purchases. We've had some realtors that say that their borrowers just says, no, I'm not going to purchase, I'm going to wait and see what happens. I think a lot of just the fear that some people are having is causing them to back away.
So we try and get the buyer to understand low interest rates, the benefit that gives them, and why they may not want to wait. Matter of fact, I talked to you about coaching a young couple through, and their number one question was, oh my goodness, should we buy? And I said, okay, is your job in a good position? And they went, oh yeah, we're both engineers. So there's plenty of work for us to do. We can work from home, technology set up, everything's good. I said, do you have your down payment? Yes. Is the interest rate better or worse than it was a month ago? Well, it's better. I went, why are you worried about buying this house? Is the house in good condition? Yes. Well, let's buy the house. When you have a smart buyer that looks beyond the short-term issues. Remember, this outbreak will go away. Yes, will it pivot where we are in the real estate market? These types of things always do. So we'll have a small pivot, but they're making a decision for 10, 20, 30 years. They don't let a 2 or 3 month issue kill their deal.
Joining us to discuss how COVID-19 is impacting small businesses in the state is Frank Knapp. He's the president and CEO of the South Carolina Small Business Chamber of Commerce. Frank, thanks for joining us.
Oh, well, thank you very much for the opportunity.
So Frank, we've seen events canceled across the state. Tourism is halted. Life is disrupted. We're getting a new normal going on here. What does this mean for small businesses? It's only been a few days, but things have drastically changed, is my understanding.
It's been drastically changed for a week or so. Consumer demand is down to the floor. Businesses are closing, not only in South Carolina, but across this country. Small businesses are in a crisis. And we have got to figure out, and the Congress is working on it, a way of infusing in small businesses the cash to keep them alive and let them have an opportunity to survive through this, so that when we get out of it, we will actually have our small businesses ready to start functioning again and to start hiring back people. That's really going to be critical. After the Great Recession, it was small businesses that led the revival of the economy by hiring back their employees. And so we've got to make sure that we have our small businesses in place when we get out of this.
And you just brought up, talking about the Senate with the bill, the $2 trillion stimulus bill, phase 3, they say. Haven't voted on it as of this taping, but it looks like it's going to pass at some point. There's some discussion again about unemployment benefits and also, looking at corporations and how much they get. I want to know, just really when we look at that, what it means for small businesses. Is it more credit? Is it more ability to get loans? We've seen the SBA come to our rescue too a little bit more. What's really out there right now for small business owners, maybe in that bill, and then also what we've seen already passed into law and as part of declarations?
Well, the $367 billion that they have in the stimulus bill that is for guaranteed loans to small businesses, that's really turned out well. And I congratulate Congress for listening to the small business community and listening to the needs that they have. So basically, these loans will be available to small businesses right away. They will be flexible. They will be sufficient to maintain the business probably for 8 weeks. That's what the intent was. They will be easy to get, and they're refundable. So basically, it's calculated as 2.5 times the average monthly payroll is what the small business will be able to request. And if they use that money for payroll, for rent, for utilities, or for mortgage interest, all of that money that they borrow will be forgivable. In other words, they will never have to pay that. That will never go on as debt. It will almost be like a grant. Now, if they use it for other business expenses, then they will have to make loan payments on that. But all the loan payments are pushed off for 6 weeks. 6 months. I feel real good about that. The small businesses are going to be in a position to go to a private lender who does SBA loans and provide just documentation that they were in business as of the 15th of February, and they will be able to get a check hopefully within about 7 days.
So a lot of good information out there for small business owners, and we'll see that continue going through the Congress. We have a few more moments left. And Frank, I want to talk about tourism. I think that's probably the hardest hit industry in South Carolina. It's a $23.8 billion industry in South Carolina. 1 out of 10 jobs is affected by tourism. $1.8 billion in state and local taxes collected. How do we see that shaping up right now in terms of where we go with this? You know, it's the early beginning part of the season for tourism, essentially, even though there are really no seasons left for tourism here. But how do we see that being affected? And are some of these places going to be able to come back at all when we look at this?
Well, you're absolutely right. We don't know how many are going to go away permanently. Tourism, as you said, is a big part of our economy, and they are seasonal. And if they don't have the consumers coming to them, they may not be able to return. So we're going to hope that a lot of those tourist venues and the businesses that serve the tourists don't have a lot of debt, and that if they have to close and don't even want to get a loan, although they should try to get a loan because you never know what's going to happen. Things may turn around quickly, or we don't know. So we encourage them all to try to get these forgivable loans to stay in business as long as they can. But if it goes on too long, I don't know how a lot of those tourist-related businesses will survive this. Now, small businesses and small business owners and entrepreneurs are very optimistic, and if they go away now and they don't have a lot of debt, they will probably resurface when things are better. But what we want to do is try to keep them in business as long as we can through this crisis, and hopefully the crisis will be over and they'll be ready to go.
Gotcha. It's an ever-evolving situation, Frank, and we appreciate you making time, and we'll be talking to you in the future as this continues to evolve. It's Frank Knapp, who's the president and CEO of the South Carolina Small Business Chamber of Commerce. Thanks, Frank.
Thank you very much.
Telehealth is an important technology to help diagnose patients with COVID-19 in this ongoing fight. And our telehealth team has the latest on how hospitals in South Carolina and across the country continue to battle.
So welcome, everybody. Welcome to the Sprout COVID-19 telehealth call. We are very excited to have everyone join in.
Dr. Dave McSwain is the co-founder of Sprout, a national group of pediatricians working together to research telehealth in children's health care. Now they're sharing best practices to use telehealth to fight the coronavirus pandemic.
We're well suited to address emerging issues that impact telehealth, such as COVID-19. And in fact, it is our responsibility for our patients and for our communities to do our best to address this.
Telehealth is the exchange of medical information from one site to another through technology. In its most common form, it looks like Skype or FaceTime, with a doctor on the other side of the screen. On a conference call this week, Sprout's members shared how each hospital is embracing telehealth to combat COVID-19 in their community.
Number one, our main focus is actually enabling inpatient telehealth in our own shop to accommodate a virtual PPE model and trying to minimize exposures to healthcare providers.
In Seattle, ground zero for COVID-19 in the U.S., Dr. Mark Lowe says that they're trying to use telehealth wherever possible, limiting exposure for workers without compromising communication.
Number two is that we're trying to increase the use of clinic-to-clinic telehealth. Third was we're converting in-person clinic visits to phone visits.
South Carolina's hospitals have adopted a similar strategy. McLeod, Prisma, Roper St. Francis, and MUSC have all offered free screenings through their online care platforms. MUSC's Dr. Katie King says telehealth has been critical to the hospital's response.
First off, we've been using our virtual urgent care tool as kind of the public health screening mechanism for the state and the pathway for testing. So folks are directed to that tool, screened through a standardized protocol, and then the testing is ordered through that system, at which point they're directed to a scheduled visit at a drive-through testing center.
Several hospitals and Sprout said they're working to get more doctors trained on their telehealth platforms to meet the increasing demand for online screenings. Some have considered letting doctors see patients from home if they're not sick.
We have looked at options as well in terms of people working from home and doing virtual visits or managing some of our e-visits as well.
Dr. Daniela Izakov is a pediatrician at the Cleveland Clinic in Ohio.
As well as looking at this option if people happen to be quarantined, either, again, doing virtual visits, either scheduled or on demand, or addressing some of our e-visits or other remote monitoring.
Sprout ended its call focusing on what we can learn about telehealth from this pandemic. They are a research group after all. Dr. John Cho from the Children's Hospital in Philadelphia says this will be a teachable moment that will inform how hospitals across the country deploy telehealth in the future.
This is important because we need high quality data to help guide us in a pandemic situation, and I'd like to expand this outside of COVID-19 even to when we have crisis situations. It helps us refine our telehealth programs to address the needs of our patients.
Stay updated throughout the week by following scetv.org, southcarolinapublicradio.org, and listening to the South Carolina Lead podcast. We'll be dropping those pods regularly as news breaks. You can find them on your podcast app, wherever you find podcasts, or on southcarolinapublicradio.org. From South Carolina ETV Studios, I'm Gavin Jackson. Be well, South Carolina.